Let's begin. Good morning, and thank you for joining us for our HealthPass Broker webinar, A Look into 2021. Our apologies for the unavoidable rescheduling of the webinar, and thanks to all of you who've joined us today. So a few logistical items to go over first. If you need to drop off or have any technological difficulties, or just want to hear the melodious sounds of Rob and the Carrier Partners voices again, you can join us on Thursday at 2 o'clock for the second showing. Also, if after the meeting you need further information, please reach out to your GA representative or to your HealthPass account executive, and we'll be happy to try and address any of the questions you need answered. Speaking of questions, if you do have questions that come up throughout the webinar, please be sure to use the Q&A option that shows up at the bottom of your screen. With the large number of folks we have attending and the time available, we'll be unable to address those questions now via a formal Q&A session, but we will make sure they're all aggregated, answered, and sent to everyone as part of the follow-up process. Okay, so we've got lots of information to get to, so I'm not going to take up too much of your time with a lengthy intro, but I have a few things to note. I'd be remiss not to start with a big thank you to all of our brokers and GAs from HealthPass and our mutual clients. Your value has never been greater than during these times. So speaking of these times, we can shift quickly to a COVID recap, because really what presentation nowadays doesn't have one to begin. Briefly, internally, we're fortunate not to have missed a beat. We were well positioned with our technology and able to adapt quickly to a work from home environment. But for us, and though it may change the way we work, it doesn't change what we do. I'm sure the same is true for you and your agencies. You know, the reality is that clients are desperately in need of solutions as we navigate through the pandemic and beyond. Changes stemming from COVID require more education and communication with clients than ever before. Health insurance importance has never been greater, but also the cost never higher. Employees are contributing more than ever in premium and out-of-pocket contributions, while groups who are facing escalating economic pressures are looking for creative ways where they can save without compromising the value or access their employees need. And once they find that they want to actually make a change, then there's the fundamental need to be able to make it happen in this new normal. And this is where HealthPass is the solution. At the heart of that solution are two simple words. They're the building blocks on which HealthPass can help deliver on those needs: choice and technology. So without further delay, I'll pass it over to our Director of Sales, Rob Zorsick, who will reinforce those ideas and fill in all the other words that go in between. Rob?
Thank you, Vince. Also, thank you everyone for joining today. I'm Rob Zorsick, the Director of Sales, and I'm going to try to make this as quick as possible. As usual, we have a good amount of info to go through today, so let's jump right in. When I have a lot of info to talk about, which is almost always at these events, I like to tell you the takeaways first, so you know what to listen for as I run through the presentation. This way you can pay extra attention to the most important parts. Here's today's agenda. Oh, I didn't go through the takeaways. Importance of technology in the new normal. Enroll in your group benefits anytime, anywhere. 4 carriers with 45 plan designs that will be in our portfolio this year. And HealthPass as a solution for 2020, 21, and beyond. Today's agenda will consist of a 2020 recap, the HealthPass online portal, which we like to refer to it as the HOP in technology, 2021 HealthPass plans. You'll hear from our carrier partners, and then I'm going to do a quick wrap up. When talking about 2020, it's hard not to address the elephant in the room, which we all know is COVID-19. HealthPass has been working from home seamlessly since March, and we plan to be for the foreseeable future. All of our response time metrics have been good. We've been staying on top of everything we need to and been getting great feedback. So we see no need to rush back to the office if we're not sacrificing service. When I first heard we were working from home, to be honest, I thought that meant that I'd be spending a lot of time here. But what it really meant is that I would be spending a lot of time on Zoom meetings. It's been a really busy time with a lot happening quickly. More than ever, communication of information was important, as knowledge is power. We want to keep everyone in the loop at normal times always, but especially more so in these unique times. We've sent out emails about all of the things going on. We send them out as quickly as we receive them, and we'll continue to send regular informational emails whenever necessary, which has been quite often these last few months. In addition, we've created a broker newsletter called the Broker Scoop, which summarizes all of the info we've recently shared into one succinct email for our brokers to read and reference. Carriers have been great during these difficult times, offering special accommodations, and HealthPass has been able to extend the same accommodations as the carriers to our membership and will continue to do so as necessary. When things got locked down, we were able to transition all of our in-person meetings with broker and GAs and clients to Zoom with a lot of success. Zoom is great. It's been very helpful, but particularly as a sales guy, I really miss those valuable face-to-face meetings a lot. And I'm really looking forward to a time when we can do them in person again. But fortunately, when we get back to the time where we can meet in person, I really still want to be able to take advantage of the ability to have these virtual meetings via Zoom as well. One great thing that came out of Zooms was having the ability to do more advisory meetings with more people than we could normally do in person. We did a lot of advisory meetings in the last 7 months and got some great feedback. Here are a few takeaways from the advisory meetings that we'll be implementing right away. We're going to be creating marketing rate sheets for target audiences. This would be in addition to our generic rate sheets and would be more focused on specific categories. We would love your input on what plans should go in the categories we've already thought of and would welcome any suggestion to any additional categories of marketing sheets that we can create. Also, if you're interested in joining any upcoming broker advisory meetings, please reach out to us and let us know as well, and we'll get you scheduled on one of the next ones. You also said we should offer an FSA product. Once again, we listened and we'll be adding OCA as an FSA and commuter benefits partner in 2021 with special pricing for HealthPass membership. Everyone on the advisory seemed to agree that no one really uses Health Connect to quote HealthPass and that we needed a better way to quote and customize our rate sheets. We agreed with that idea, and as a result, the HealthPass broker calculator will be live on our website very soon. I'm really excited about this, and I think that you're going to be too. So here's a sneak peek at our new online customizable quoting tool. You can begin using the broker calculator by entering some basic info. From here, you can create rate sheets customized to any group specifications. After you enter the basic group info, you then configure the employer contribution by either dollar amount or percentage, or you can leave no contribution for a version of our normal rate sheets customized with only the plans that you're looking to show. Next, you'll select which plans to display by clicking the box next to your desired carriers and metal tiers. You then identify the payroll frequency and click apply. Based on your selections above, the calculator will display corresponding plans inclusive of the information you entered and generate a customized rate sheet, which you could then save, email, print if you need, or do whatever else you need to do. It's quick, easy, incredibly helpful, and since it's all electronic, it's very compatible to working remotely. You should be seeing this calculator live on healthpass.com sometime in November with quoting available for 1-1 groups. As I talk about our technology making today's world easier, I have to mention that in 2020, we also introduced paperless renewals and paperless billing options. Online accessibility makes working with HealthPass even easier from wherever it is you're calling the office these days. Technology is becoming more relevant every day, especially considering the current pandemic, social distancing, and remote working. HealthPass makes it easy to quote, renew, bill, enter, and administer your groups all online. While some of these capabilities are not necessarily unique to the marketplace, they're certainly important and useful. The feature of HealthPass that I'm going to tell you about next is very unique to the marketplace. Working remotely makes the traditional enrollment process, meetings, benefit question support, paper enrollment forms, even more difficult. We've been trying to instill change in the way members enroll for a few years now, but I understand that change is often hard as people are comfortable with the status quo. And sometimes it takes a life-changing event like this pandemic for people to embrace change. Our method of changing the paper enrollment process has never been more beneficial than it is now. We have a member-facing self-enrollment platform that allows members to choose a plan from a phone, tablet, or computer anytime, anywhere. Your groups need this technology and they need remote capabilities now more than ever. With member self-enrollment, you can differentiate yourself while solving your clients' remote working challenges. Member self-enrollment also encourages consumerism by allowing members to shop for and make an educated decision to select their plan. And even better, this great tool comes at no additional cost and is available right now for every single HealthPass group. I know 45 plans can be a lot of info to process. The support tools in the HOP give an extra layer of support and can supplement and complement the info that the groups receive from your open enrollment meetings. These tools are a powerful feature to have to help sort through all of our choices and to ultimately get the member to the plan which is best for them. And it's really easy to use too. The GA, broker, all they have to do is enter basic group information. They choose the plan offerings, enter employee demographics and an employer contribution. From there, a unique portal page and login is created for each member, showing their group their plan offerings with rates inclusive of the employer contribution. And built right into the portal is a shopping experience where they can explore shopping and support tools such as plan comparisons, a best fit tool, and filters to help make a decision. Let's take a quick look at the member self-enrollment in the HOP. The graphic on my slide is the member's view of their portal page when they're selecting their plan. Members can view the plan options available to them, inclusive of the employer's contribution. They can then choose several plans that they would like to compare and view the benefits side by side for an apples to apples comparison. There's a best fit tool that the member can use where they're given a basic health risk assessment, which then uses Milliman data to suggest the best plans based on the answers provided in the assessment. Members can also choose multiple criteria to filter their options, similar to how you might shop for a hotel or airline tickets on a website like Travelocity, using filters to find the plans that they would like to explore. A simple click and confirmation of a plan, and the member has now shopped for and made their plan selection online with zero need for paper. The member will select all lines of coverage this way, and once they're done, they can view, email, or print a confirmation, and they're finished. That's it, done, quick and easy. But not only does the portal save members from dealing with the cumbersome paper process, it helps you avoid that as well. Printing, scanning, deciphering handwriting from, and uploading and emailing enrollment forms is no longer necessary. And to even further make your lives easy, the portal has robust reporting capabilities which allow you to easily track the progress of every member of the group via the report center dashboards. Via the reporting dashboard, you, the broker, GA, or even the group can view pie graphs that show exactly where the employees are in the enrollment process. You can quickly see who has started, completed, and those that have not even logged in to make their plan selection. The middle pie chart shows details about which specific carriers have been selected. And the third pie chart gets as granular as being able to show you what specific plans the members have chosen. In addition to the colorful pie graphs, you can actually view an Excel report with full member demographics of all of the members in any category you choose simply by clicking the corresponding piece of the pie chart. If you're concerned that not everyone in a group can handle self-enrollment, you always have the ability to enroll any member as you normally would as if they were not doing self-enrollment on the member's behalf at any time during this process. You could always use a hybrid approach of using both methods of a plan selection to make sure that everyone has a plan selected. Member self-enrollment with its support and decision-making tools is a great way to supplement the open enrollment meetings that you're doing, presumably via Zoom. It's a smart, easy way of enrolling in benefits. It's an entirely remote process, and it allows members to enroll anytime, anywhere, from any device. And while member self-enrollment is beneficial and easy for new groups, it's even easier for renewals. The group information is already in the HOP. The employee's info is there, so you don't have to enter that. And we provide detailed instructions and renewal packages on how to use it. Another great thing that came with Zoom meetings for us is the ability to do practice renewal Zoom meetings with the HealthPass rep, where we can actually walk you through one of your own group's renewals in our testing environment in the hop right before they renew, so you can see exactly what the member self-enrollment process and the whole process in general may look like on your real groups that you're going to be meeting with about their renewal soon. Reach out to your GA or your HealthPass rep to set one of these up and let our technology help navigate you and your clients through the new normal and beyond. So it's time to change gears a little bit and get to the part of the presentation that I really enjoy talking about. A lot of work goes into curating a portfolio that we think offers the best choices and options for our members. As an effort to keep the presentation as short as possible, I'm going to be staying very high level in regards to carrier info, as you probably know most of this information already anyway. And then right after I walk you through the 2021 portfolio, you'll be hearing from our carriers directly who are here today, and they're going to talk a little bit about what they have going on in 2021. The 2021 HealthPass portfolio will offer 45 plans from our 4 medical carriers. Let's take a look, and up first is Emblem Health. The Emblem Health portfolio is growing from 16 plans in 2020 to 19 plans in 2021. Also, there are 2 changes to existing plans. The POS plans are becoming PPO plans and will have a national network from First Health. The national network was introduced in August of 2020 to these plans and adds a really nice benefit to already rich plans. We're also adding 3 new plans to the HealthPass portfolio. While it's not new to the marketplace, the Select Care Gold Value Plan is new to HealthPass. This plan was a very popular seller with Emblem Health Direct in 2020, so we wanted to be able to offer that popular plan to our membership as well in 2021. We're also adding 2 plans that are new to both Emblem Health and HealthPass. I'm very excited about these 2 unique virtual plans. The plans are a great new take on benefits and are really embracing technology. Both plans are offered on the gold metal tier, either with a Prime or Millennium network. They offer $0 cost sharing, including pharmacy benefits, when using telemedicine via their ACP doctors. The plans also offer non-virtual traditional benefits for in-person visits. Another nice benefit, particularly on the Prime virtual plan we're offering, is that members will have access to the First Health National Network on that too. These plans are priced attractively, and they're a great add to an already strong portfolio with options across all metal tiers and across all 3 of Emblem's networks, which include the Prime network, which is one of the largest in the marketplace. Emblem Health is continuing to offer a great mix of options for members to choose from. Healthfirst had great plan offerings in 2020, and they brought them all back in 2021, and we are as well. The only changes to this plan are a few minor changes due to AV. Healthfirst plans in 2021 experienced low rate increases, making them even more attractive. And it actually, in fact, this shocked me when I saw it the first time. First quarter 21 rates are actually lower than fourth quarter 2020 rates. All of the HealthFirst plans were popular for us in 2020. They offered strong benefits at a great value. And in most cases, then and in 2021, they're the lowest costing price point in the marketplace. Lowest plan coming in at around $500. I'd like to call out 1 or 2 of these plans as being particularly noteworthy, but to be honest with you, they all offer great value, giving strong benefits at competitive pricing. With a strong network, I know you'll find HealthPass to be a great option to all of your groups and members, and I ask that you really give them a good look this year. The Oscar portfolio, which I'm sure is not a surprise to you by now, will look very different in 2021. As I'm sure you're aware, Oscar is reducing their direct portfolio, and such is the case with HealthPass. The HealthPass portfolio will offer 1 plan, each on the gold, silver, and bronze metal tier. And just like Oscar Direct, all Circle Plus plans are discontinued for 2021. All of our 2021 Oscar plans will be on the Circle network. Fortunately, HealthPass has 45 plans for any displaced membership to choose from. But first, let's go over the mapping for displaced members. Circle members will be mapped into one of our existing Circle plans by metal tier. Platinum and Gold members will go to the Gold plan. Silver and Bronze will go into each of those tiers respectively. Circle Plus members will be mapped into one of our other carriers' plans. And the mapping actually looks pretty favorable for members. Platinum and Bronze members will be mapped into plans with similar benefits within those metal tiers. Gold and Silver members will be mapped into plans that are actually a metal tier higher up from where they currently are, giving them similar or richer benefits on a higher metal tier. And the big thing is that members in all metal tiers will be mapped into a plan that will be a decrease from the premium they had last year. In some cases, significantly so. I want to say that again. Circle Plus members will be mapped into a plan with similar or richer benefits in the same or higher metal tier and will be paying less in 2021 than they did in 2020. One of the great things about HealthPass is how easy it is to move disrupted membership without moving the whole group. Each member has a plethora of HealthPass choices into which they can migrate. I know that we can find a similar, if not better fit with another carrier and actually reduce premium while doing so. This is true not only for HealthPass Oscar members, but for Oscar Direct members as well. All Circle Plus members and probably many Circle members will be looking for a new home. HealthPass is the best way to allow members who need Oscar for any reason, maybe they love the technology, to stay with an Oscar plan. Then by bringing the rest of the group to HealthPass, you can offer other members of that group the ability to find a different carrier plan with richer benefits at a lower price point while keeping that one member who really needs Oscar in that Oscar plan. There are a lot of different options we can go to and can show some good savings and good plan designs for all of these groups. Please reach out to your HealthPass rep so that you can go over the options. So let's go back to talking about adding plans to the portfolio. In 2021, HealthPass is increasing its Oxford portfolio from 12 plans to 15. I'm excited to add some of Oxford's new plan designs to the portfolio. We're going to continue to offer the same Metro plans that we had in 2020, which are only seeing minor benefit changes due to actuarial value. In addition to our current Liberty plans, we're replacing one and adding 3 new plans. As you know, all 411 plans are being discontinued with Oxford Direct. So our 411 Platinum plan, which is also being discontinued, is being replaced by the new Liberty Platinum Tiered Benefit Plan. This plan features lower copays for utilizing Tier 1 rated providers, while also offering regular copays for the entire remainder of the Liberty network. This plan is a nice upgrade from the discontinued 411 plan and is a great Platinum plan on the Liberty network that should be attractive to members who are looking for a rich plan. We're also adding 3 other plan designs that are new to both Oxford and HealthPass. The Oxford Silver Liberty 5100 ZD will be added to the 2021 plan offerings. $0 deductible plans have been very popular, and as expected, Oxford does a great job with theirs. In 2020, the only Oxford ZD Silver plan was on the Metro network, which is also a great plan, but I think that a 2021 Silver ZD plan on the Liberty platform is going to be a very popular add to our plan offerings. In addition, we're adding 2 Motion HSA plans. These are new plan designs to New York, which have been popular in other markets, and provide incentives to employees for walking and doing other activities. Members can earn money towards their HSA or HRA accounts in the form of a gift card by achieving set frequency, intensity, tenacity, and participation goals. It's a really cool take on a traditional HSA and gives it a really unique twist. And they come with a strong Liberty network as well. These plans are great additions to an already strong Oxford portfolio that includes many of the top selling plans in the marketplace. So HealthPass is constantly evaluating our book to ensure that we have a sustainable business. From time to time, in order to ensure this sustainability, we need to change our plan offerings and guidelines. Effective for 1/1, new groups and renewals, In order to offer a Liberty plan to a HealthPass group, there will be new participation requirements. In addition to our existing participation rule, any groups offering Liberty must have 60% of eligible employees, after valid waivers, enroll in any Oxford plan. And any Oxford plan could be Liberty and or Metro combinations. This PAR should sound really familiar to you, as it is the exact same participation rules that Oxford uses for their direct groups. Almost 90% of the New York small group marketplace is already meeting this PAR with Oxford, and 85% of current existing HealthPass groups that are on the books right now are currently meeting this PAR requirement, so it really shouldn't cause that much of a disruption. Again, this PAR only applies to groups who want the Liberty plan, and groups not taking a Liberty plan will not be subject to this new rule. However, normal HealthPass participation rules would apply. To help enforce the Oxford PAR and to align ourselves with the majority of the market, we've updated the list of what we consider valid waivers. It looks basically the same as it used to, as we're only removing other employer-sponsored plans, individual, and exchange coverage as valid waivers. We typically don't see a ton of these on our groups, and this is a very common standard in the marketplace. For any specific questions, please reach out to your GA rep or your HealthPass rep. Next up, you'll be hearing from our partner carriers. Today, you'll be hearing from Drina Pross from Emblem, Justin Cortez from Healthfirst, and Miriam Lau from Oxford. Up first, I would like to introduce Drina Pross from Emblem Health.
Thank you very much. Thank you for this opportunity to highlight the 2021 small group platform. During the COVID pandemic, many of you were looking for ways to continue to add value to your clients and the need to partner with carriers that aren't standing still, but are committed to being innovative and delivering unique options to the marketplace. That's Emblem Health. I am Drina Pross, Director of Small Group Sales, and I'm so happy to spend the next 5 minutes with you sharing some exciting updates about what Emblem Health has been focused on as we continue to help you and your clients. Think you know Emblem Health? Think again. As Rob said, we have introduced a new national network, First Health. That came into the market on 8/1, and it has been very, very successful. We partner with them because of their extensive network throughout. So those are for those groups that have people that may be remotely working in Colorado, California. This is a great network to do. In 2021, as Rob said, we're introducing 2 new plans, a PPO and EPO virtual plans. I am so excited about this EPO virtual plan. Let me tell you a little bit about it. It's a hybrid model. We're using digital technology to complete the care experience and the ability to swing in and out of virtual visits and in-person visits with zero copay. Yes, I said zero copay. And we are partnering this new EPO virtual plan with one of our largest providers in all of our networks. It's called ACPNY, Advantage Care Physicians. I know you know about them because we've talked about it before, but let me just give you a small recap. Advantage Care Physicians has 39 locations in the New York City and Long Island locations. Something you may not know about ACPNY. Did you know that New York City and New York State have partners and chosen ACPY locations for COVID testing? Tell me, is that not a great endorsement? What does that tell you about the care and the ability to deliver from these locations? But let me tell you about some other new technologies we've introduced. At 10/1, I'm so excited. We have introduced our new broker portal. You know as well as I do, I have been talking about this ad nauseam, but let me tell you about a couple of the features. One is visibility. Now, what do you mean by that? Well, what I mean by that is when you go into the new broker portal, you can see your entire book of business. That's large group, small group, individual, dental, and Medicare. That's brand new. We've also improved quoting and the enrollment experience, making it easier for you, the broker, to not only quote the plans, but to actually enroll with us. We've enhanced our digital ID cards. So when you submit through our portal, you can automatically get a temporary ID card and it's downloadable. a document repository. So you have everything you need and all the forms you need to do business with Emblem. You have the ability to add new plans. You have the ability to add in term members, no more paper. And in coming in 12/1, December 1st, renewals can be done on our portal, okay? But remember, this is just an additional tool for you, the GA and brokers. You already know that HealthPass has advanced technology and superior service. We've partnered with them so we can do it. The other thing we want to bring to you is our mobile app. Our mobile app is for our EPO virtual plan. On this new mobile app, you can make appointments, you can schedule, you can see the same doctor at the ACP-NY facilities. That's something you can't do with telemedicine. The other great thing is when you use this mobile app, you can see your entire medical records. That is so important. So when you are talking to your doctor, you don't have to think about when last time you had a colonoscopy or when women went to the OBGYN. This is really incredible. Another upgrade that we've done is called Sunday Sky. It's a member engagement tool. It's an animated video explaining the members' benefits. There's nothing worse than becoming a member of Emblem and not really being sure of what your benefits are. This new technology caters to you and your benefits. It is incredible. Let's talk about the national network. We've got regional networks, we've got national networks. So we've got national network, First Health, the Prime Network, which is New York, New Jersey, Connecticut, Select Care, which is New York only and has 28 counties, and the Millennium Network that we introduced last year, the 8 downstate counties. Remember, we're New York born and bred. We're the largest homegrown health insurance company in New York, for New York, by New York. Who are we? We're the new Emblem Health. By listening and responding, we're bringing you strong small group offerings, multiple networks, the new EPO virtual, the hybrid model that allows you to swing in and out. You don't have to change your plans. Sometimes you may want to do a virtual visit with your primary care doctor. Other times you may want to see them in person. You can do that on this plan, one plan at zero copay. Emblem Health continues to be focused with innovative options to meet the needs of your clients. Remember, we are committed to your success. That's Emblem Health. Thank you for your time today. Back to you, Rob.
Thank you, Drina. Next up is Justin Cortez from Healthfirst. Justin.
Good morning, everyone, and thank you to HealthPass for this opportunity, and thank you to our broker and GA partners for your time today. I'd like to start, if you can go to the next slide. I'd like to start with who we are to, more than anything, arm you with information for when your groups have come to you with any questions or concerns. Healthfirst is a nonprofit hospital-sponsored carrier in the New York market for over 25 years now. Last year, we did over $11 billion in revenue. We have over 1.5 million members across all lines of business. 46,000 of those lie in our commercial and small business space. That encompasses individual on and off exchange, as well as about 20 to 25% of that encompassing our small group membership. Next slide, please. So we've touched quickly on who Healthfirst is, but who is your average Healthfirst member? Actually, your average Healthfirst member is your average New Yorker, middle class, middle income, and looking for the best bang for their buck. Our members come to Healthfirst because of the value we offer by our robust plan designs, a quality network, and market-leading price points. You can see that 64% of our membership lies in our gold tier with our 2 zero-deductible gold plans because they offer a high value at an attainable price point for your groups and for the members of those groups. You can go to the next slide. On the screen in front of you, you see a matrix comparing price versus network in the small group market today. On the right-hand side encompasses what we call the high market. It encompasses your higher cost, larger national network plans and carriers. On the left side is what we'll dub the low market, and that's the bucket that we play in at Healthfirst. Your lower cost, local network carriers. Carriers like Emblem, Select Care Network, Oxford Metro, Emblem Millennium, Oscar, and us, Healthfirst. As you can see, our network is on par with the others, such as Emblem and Oxford, but what we offer is a price point that is far below all the rest. You can go to the next slide, please. We've taken an overall enhancement to our network coming into 2021. We've enhanced the entire network experience. First, in 2020, we brought Memorial Sloan Kettering into our network, rounding out our hospital portfolio at 63 hospitals. Next, we overhauled our provider search tool at hfdocfinder.org. After hearing concerns from the broker market, we've completely overhauled it, and now this provider search tool is more accurate than ever, and you can search for providers for your groups with confidence. We've added same-day delivery options for prescriptions. We've responded to the world around us. So we've brought in Medley, Capsule, and Exact Care to meet those same-day delivery needs for your groups and clients. And going into 2021, we're bringing CVS Minute Clinics into our network for access to those sites, both in the service area and nationwide. You can go to the next slide. So what do our plans look like? We offer 3 bronze plans, 2 of which are HSA compatible, and one of them, our Bronze 8150, is the lowest cost plan on HealthPass, and as well as the small group market as a whole. We offer 2 silver plans with moderate deductibles that put the highest utilized benefits of PCP, specialist, urgent care, and advanced imaging outside of that deductible, and those all go straight to copay. We offer our 2 top-selling zero-deductible gold plans, our Gold and Gold 2550 Zero Pro EPO plans, and our Platinum plan rounds out that portfolio. You can go to the last one, Rob. So what to expect from Healthfirst going forward? First, competitive pricing and high value. Partners like HealthPass make it easy to provide Healthfirst as a low-cost value option to your clients, alongside another plan with a national network that some key employees may need, but not all in the group can afford. Superior service from both your HealthPass and your Healthfirst teams. And of course, continued stability and growth. We've grown our portfolio, membership, and network each year and look to continue to do so. Not only are we the most competitively priced carrier in the market in 2021, but we are still the most competitively priced carrier in the market for 2020 as well. We reduced our rates by 4.7% in 2020, and on top of everything else, this year looks like it's giving the market an unprecedented Q4, where to many groups, price looks to be king. Thank you all for your time today, and happy 4th quarter.
Thanks, Justin. Next up is Miriam Lau from Oxford. Miriam.
Thank you, Rob, and the HealthPass team for your partnership and for inviting me to talk to our GAs and our broker partners this morning. My name is Miriam Lau. I am your Oxford account executive on behalf of your Oxford team. I wanted to thank our brokers for the support and the extra care and attention you've given to our mutual clients during these tough times. Together, we're weathering the storm. With 85% market share, Oxford takes our market position seriously, as well as our responsibility and commitment to the people we serve. In May, we offer a 15% premium credit to our fully insured clients, totaling over $1.5 billion in premium relief. United Health Group is also honored to have been asked by HHS to help distribute the initial $30 billion in emergency funding to healthcare providers under the CARES Act. We've offered off-cycle buy-down opportunities. We've relaxed our requirements for sweat equity, a gym reimbursement program to allow home workouts, online classes, walking, running, while many of our members are not able to go back to the gym. In addition, we've waived cost shares for emotional support, telehealth, virtual visits since the pandemic. Let's now look ahead to 2021. I'm very happy to say that for the 6th consecutive year, Oxford will again have a single-digit increase, 5.3% on average on our overall portfolio. About 98% of our plans will get less than an 8% increase. As a result, we have improved our rate favorability against many of our competitors, and we're looking forward to a productive year with you. Next slide, please. The zero deductible plans, the ZD plans, are new this year, and they've been a huge success already. Clients love these plans because they want easy to understand benefits like zero deductibles, straight copays. That's why we're adding a new Liberty Silver ZD plan, the middle plan here in 2021. These are all non-gated, and the Liberty options have national access to Choice Plus. I did want to note that in 2021, Long Island will be rated 1.25% higher than New York City. And next slide, please. I'm very excited to introduce to you our brand new plan, the Liberty Platinum PD plan, which will be replacing the Platinum 411 plan. Members can take advantage of the lower copays for our Tier 1 providers, which are those quality providers who have met our criteria for cost and efficiency. These providers will have a blue dot indicating this Tier 1 status. This plan is on the Liberty Network, non-gated with national access. Let's take a look at the plan. As you can see, members will have very low copays when visiting Tier 1 providers, $5 PCP, $35 specialist, and you're not just limited to Tier 1 providers. You can always just pay a little more for other Liberty providers. Next slide, please. We're also thrilled to bring Motion plans to our New York small groups in 2021. Like Rob said, Motion has been around for several years in other markets and are very popular. These are HSA plan designs where members can walk off the deductibles. Members can earn dollars into the HSA in 4 different ways, as you can see on the left-hand side. If you take a look at tenacity, if a member takes 10,000 steps a day, they earn $1. In total, you can earn up to $3 a day, up to $1,095 per year. Many of you probably already wear an Apple Watch, Fitbit, so this is a great way to get rewarded for things that you're already doing. Let's take a look at the plan. We're offering 2 Motion plans, one gold, one silver. They're both non-gated Liberty Network with national access. The gold plan is a single deductible of $1,500. What it means is you can basically walk off that deductible with the $1,095 in Motion rewards. There's no need for the employer to fund the deductible. This is not coming out of the employer's pocket. Oxford is putting those dollars into the members' HSA accounts. These are competitively priced. The silver plan is just over $750. And we'll have a ton of marketing materials to help you sell these plans. Next slide, please. Lastly, Metro. Our clients can save 16% by moving to Metro within the current metal level, and that's better than Geico. With the current environment, Metro really is the solution for clients to save money while still getting a quality plan and a network from a carrier your clients can trust. We know some other carriers have micro networks, but that's all they offer. With Oxford, a client can have both a national network, our very own Liberty, and a local network, Metro. Oxford is your total value solution. To wrap up, I just want to say thank you. We are your long-term carrier partner, and we've always stood by your side for more than 35 years. For 6 years straight, Oxford will have a single-digit increase, 5.3%. We're excited about our new plans in 2021, the tier network plans, Motion, the ZD plans. And Metro really has proven to be a solution to save money. When you buy Oxford, you're buying choice and flexibility from a carrier you can trust. And we'll have 15 plans in 2021 for you to choose from. Once again, a big thank you to HealthPass, to you, and to our clients. We wish everyone a healthy and successful fourth quarter in 2021.
Thank you very much, Miriam. Also, thank you to Drina and Justin. Really appreciate you guys taking the time today. So now I'm just going to wrap things up really quickly and talk about why HealthPass. HealthPass is a true private exchange offering full choice of 45 plans across 4 carriers and all metal tiers. We offer 7 dental, 6 vision bundles from Guardian. There are life, ADD, LTD, and accident plans also available from Guardian. The new FSA and commuter benefit that I mentioned earlier from OCA. ID theft, pet insurance, and more, including HealthPass value adds, which include all of the functionality of the HOP, including member self-enrollment. No cost COBRA admin with every group, which was actually very helpful for many groups going through their higher than usual COVID-related turnover. Health Advocate, which is the nation's leading health advocacy provider, and the HealthPass team, which has over 150 years of private exchange experience. Just a quick but important reminder, HealthPass brokers receive the same exact compensation from HealthPass as you would going to the carriers directly. And in addition to that, in 2020, HealthPass once again ran an admin fee program for our brokers as a bonus for selling new business. There's still time to take advantage of it. To be eligible, all you need is to enroll 20 lives from now until the end of the year. Once you hit 20 lives, you'll be paid an additional $50 for every enrolled employee, starting from employee 1 and up to however many you enroll beyond 20. Plus, there's a 10% ancillary kicker for adding ancillary lines to coverage as well. It should be a great incentive to do what you should be already doing, which is selling HealthPass. So now I'm just going to go through my takeaways again. I hope you caught them all. Now more than ever, technology is important. You should be using our online tools, the broker calculator, the HOP, and most importantly, online member self-enrollment in the HOP to have a complete virtual experience online. You can choose from 45 plan designs from our 4 carriers to use HealthPass as your solution for all of your existing groups who are looking for answers. HealthPass is a great place for you to look and show your groups for 12/1 and definitely throughout next year with a great portfolio and technology options in 2021. As Vince mentioned, we're not going to be doing a traditional Q&A, but we will be aggregating all your questions and sending them sometime next week to everyone who has RSVP'd for this and our upcoming conference on Thursday. So keep an eye out for those. Please reach out to your GA or your HealthPass rep should you have any additional questions on anything that I went over today. And once again, thank you very much for everything you do. Thank you for taking the time to listen to me today, and have a great day.